All right. Good morning, everyone, and wishing you all and your families a happy and healthy new year. I'd like to get started with the ASF Subcommittee meeting. And do we need to do a roll call? Probably do before we get started. Kathy, thank you.
Okay. Ready? Secretary Sutters.
Present. Good morning.
Rena.
Yes, I'm here.
Dimitri.
Good morning, I'm here.
Cassandra.
Yep, present. Good morning.
Good morning. And I do not believe Faye Ruth is here, but in case I missed her, Faye Ruth. No. Okay, thank you.
Okay, great. Thank you. We have a busy agenda. Let's start with, we would like to approve the meeting minutes from the subcommittee meetings that occurred in 2021. In the future, I'm going to apologize. We will not delay this much in the future because it gets hard to remember, or at least age related it does. But let's do that now. So we should have gotten in your email from Carrie last night, January, May, and June meeting minutes. So we'll take them each individually. Does anyone have any comments on January 2021?
No.
No. Okay. So do we have to approve each of them separately, or can we approve them all together?
I think we're going to need to do them separately, only because I'm going to need to abstain on one because I wasn't at the meeting, and I'm sorry about that.
Got it. Got it. Okay. So let's start with the January one. Do I have a motion to approve?
So moved.
Thank you.
Second.
Thank you. Any discussion or objections? Okay. All in favor?
Aye.
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 Do we need to do roll call or can we?
I think we have to do roll call.
Okay. Secretary Sutters.
I'm going to abstain. I'm sorry.
Rena.
Yes.
Dimitri.
Yes.
Cassandra.
Yes.
Thank you.
Fantastic. May 2021, any changes or questions or comments? None. Okay.
Okay.
A vote
Ready?
to approve, please.
Motion.
Second.
Okay. Secretary Sutters.
Approve.
Rena.
Yes.
Dimitri.
Yes.
Cassandra.
Abstain.
Perfect.
Please.
Thank you.
Okay. And then June 2022, any comments or edits? No. Okay, great. Vote to approve, please.
I move the motion.
Thank you.
Second.
Okay. Secretary Sutters.
Approve.
Rena.
Yes.
Dimitri.
Yes.
Cassandra.
Approved.
Thank you.
Thank you. And Kathy, we should note that Faye Ruth is present, please.
Okay. I see that she is.
Fantastic. Thank you. Hi, Faye Ruth.
Good morning.
All right.
Apologies for being late. Just
No
virtual
worries.
meeting world. Thank you.
All right, so let's move on to the rest of the agenda because it's packed. We're going to do a review of the fiscal year 2022 and 2023 financials. We'll do a personnel review, and then our auditors from KPMG are here to talk about the fiscal year 2021 audit. So Carrie, I'll hand it off to you.
Thank you, Rena, and good morning, Madam Secretary and members of the ASF Subcommittee. Sorry. The purpose of today's meeting is to review updated fiscal year 2022 financial projections, as well as share with you our fiscal year 23 maintenance budget recommendation that was submitted to the governor's budget staff on January 10th. Our budget projections are based on two key assumptions. The first being the federal public health emergency. Since the board approved the budget in July, the PHE has been extended from December 31st of 2021 to April 15th of 2022. Because of the protections that are afforded by the PHE, QHP eligible members currently remain in Mass Health. If the PHE is extended beyond April 15th, this would have budget implications, which we will discuss on subsequent slides. And secondly, we do not assume passage of the federal Build Back Better legislation, which among many other items would continue the more generous federal subsidies that are currently provided under the American Rescue Plan. If there are no questions on this slide, I will proceed to the next. This is likely a familiar slide that we enjoy sharing with you. This does show what it costs the Health Connector on a per member per month basis to administer our programs. When you exclude one-time cost, FY23 is estimated to be just over $23, which is approaching the last level that we saw in about FY18. So we are hoping for additional efficiencies in fiscal year 24. If there are no questions, I will proceed with the FY22 update, and I'll hand it over to Edith, our actuary.
Just a quick question with regard to the per member per cost. What are we doing to try to bring that number down? While I know it's somewhat in line with what other organizations are doing, are there more efficiencies that we can derive from the processes that we have in place to make this more effective? Because we're spending a lot on technology. Can we incorporate more technology to bring down the costs?
Louis, you're on mute.
Yeah, it's a good question, Dimitri. You can see from the fiscal 22 to fiscal 23 projection, we are expecting a drawdown in per member cost. Part of that is because of anticipated growth in membership. I think more responsive to your question is the fact that we're working with Accenture, the new customer service vendor, to implement a range of additional efficiency measures in their handling of customer service calls and transactions in a platform release they're planning for later this calendar year. I think, to be honest, Dimitri, much of the last couple of years has been kind of the sheer brute force of trying to get from one expiring vendor contract to a solid set of platforms for new customer service. So this bears more focus. Yeah.
Are we at a point now, given perhaps the stability with Accenture, where we can really start to look back at all these processes and to see how we can generate more efficiency from all these processes that we have in place today?
I believe that's the case, Dimitri, because it's finally, we're out of the major implementation mode of billing system, customer service vendor, and the like, HICS stabilization. So yes, I do think we're at a point where we can approach this more methodically, and we'll take your comment as instruction to do so.
Thank you.
So Louis, just building on what Dimitri said. So does this where if we add enrollment brings down fixed costs and thus brings down the PMPM?
That's correct. Yes.
I'm just making sure that it's been a long morning on other kinds of budgets. I'm just, right. So this is where growth, right? Stability of the systems, not making major changes in the architecture, if you would, of the connector, and then growing, right? Building enrollment should bring down, should make things more efficient and therefore lower the cost. Is that fair?
That's absolutely fair. Yes.
No. Well, it's taken a while to get there because of a lot of things you had to put in place in terms of what I call the architecture, underlying systems. Okay.
Thank you, Secretary.
And I appreciate Dimitri, this has always been an important page for us to be focused on. So, right. That was a statement more than anything. You don't need to respond to that. Thank you.
Okay.
I was muted anyway.
Thank you again for your questions, and I'll pass it over to Edith to discuss the FY22 update for the programmatic budget. Thank you.
Thank you, Carrie, and good morning, Madam Secretary and members of the ANF Subcommittee. As Carrie mentioned, for FY22, we assume that the public health emergency period will not be extended beyond April 15, 2022. So under this assumption, the Health Connector is likely to see a few hundred members coming in May, but membership will start increasing in a more significant manner in June and July. If PHE is further extended, the programmatic budget cost will be reduced, but the administrative budget impact would be unfavorable. Also, as discussed in prior meeting, FY22 includes an added second tier for premium stabilization to help the lowest cost or the lowest income enrollees in ConnectorCare be better able to afford carrier options that include a greater number or different providers, while preserving the competitive aspect of ConnectorCare that are working well. So we want lower income enrollees who are more likely to be from communities of color or immigrants not to be facing inequitable barriers when they want to see a provider closest to them or with whom they have a care relationship. So are there any questions? If not, we can move to slide 6. So net of FFP, FY22 is estimated at 79.9 million, which is 21.6 million favorable to what was presented at the June ANF subcommittee meeting. Most of the variance is attributable to lower membership resulting from an extension of the public health emergency period. The rest of the variance is due to calendar year 2022 rates, which resulted in lower state premium RAP costs because the gap between the rates of the lowest and the second lowest cost carrier is widening. Also, carriers made some correction to their CSR reconciliation file, which resulted in a favorable variance. Are there any questions? If not, I'll turn it over to Nooper to talk about FY22 enrollment.
Thank you, Edith, and good morning, Madam Secretary and members of the ANF Subcommittee. FY22 enrollment reflects an 11.3% decrease relative to the estimates presented to the board in July, largely due to the extension of the public health emergency that Edith cited. So our board version assumed an end date of December 31st, 2021, while the current version reflects the April 15th, 2022 end date. Are there any questions on this slide? Okay. On slide 8, you'll see the primary driver of the 0.8 million unfavorable net position variance is implementation for the walk-in centers. The board assumptions reflected very preliminary estimates from our vendor, which were then updated for inclusion in this budget. Additional drivers of the net position have an almost neutral impact to the bottom line. First, enrollment-driven carrier fee revenues are largely offset by expenses for call center enrollment and premium processing. Secondly, you'll see navigators and outreach, consulting, and strategic plan investments all reflect the reallocation of key policy projects between these line items. One variance that we would like to highlight is the 2.8 million favorable variance to the reserves. This reflects a 3.6 million favorable variance relative to board estimates for the prior year based on our FY21 audit results. This in turn improved our FY22 beginning reserve balance by the 3.6, which if you net against the 0.8 million unfavorable variance to the net position gets you to the 2.8 million favorable reserve variance in the exhibit. Are there any questions on this slide?
Yes. What do you mean by reduction in strategic plan projects? What projects are you talking about?
I don't know if Audrey's on the line and would like to speak to that.
I believe
Newper, that this reflects some deferrals around decision support investments. But I welcome thoughts from others. But I would say that the key strategic priorities that we discussed with the board in December are all remain on track. But I think this was earlier topics that have been discussed that were a bit more focused on kind of technology supports for decision support and kind of plan selection that ultimately didn't end up happening last year.
And that's correct. It's a relatively small balance that's carried in the strategic plan investment line, the 175. So this was an attempt to say we're going to be very focused on unwinding this year on racial equity and several other things that we just had come to kind of the end of a trail where a site existed on the remaining strategic plan investments.
Got it. Thanks, Stu. Thanks, Lois.
And are there any additional questions on FY22? Otherwise, I will turn it to Edith for FY23. Oh, I think Edith, you're on mute.
Sorry. Thank you. The following assumptions are included in FY23. So as mentioned earlier, we're assuming that the public health emergency period will end mid-April of this year. For the purpose of this budget, we're assuming that the more generous CPTC subsidies of the American Rescue Plan will not continue into 2023. Inflation is high, so FPL increase is assumed to be at 5.5% for a family of one, which impacts the enrollee contributions. So for this budget, it was assumed that the methodology used in the calculation of the state affordability schedule is unchanged. CSR loaded rates continue for 2023. Premium stabilization continue for 23 with the same approach as 22, which includes a second tier leveling, and we didn't assume any changes in carrier participation. Are there any questions? If not, we can move to slide 11. So net of FFP FY23 is estimated at 158.3 million, which is 78.4 million higher than the current projections for FY22. The increase is mostly due to an uncertain future for the federal Build Back Better legislation. As mentioned earlier, for this budget, we're assuming that the more generous APTC subsidies do not continue into 2023. Decrease in CSR reconciliation reimbursement for calendar year 2021, resulting from lower advance payments and higher claims for 2021 when compared to 2020 is also an important contributor. The remainder of the variance can be explained by an increase in CSR advance payment for 2023 coming from the normal increase in premium and claims, an increase in membership due to the end of the PHE, and a higher CCTF draw. Any questions?
Can you remind us, I know that we had talked about it a while ago, when there is going to be a potential impact on the budget or the carriers around the Tufts and Harvard merger? I remember, I'm just trying to situate the dates and sort of see where that shows up between the last slide and this slide.
Is there anyone that wants to take this question? I think the merger will happen for 2023. So it's going to be mostly like Harvard Pilgrim and Tufts Premier that will be impacted. Tufts Direct, which is in ConnectorCare, I don't think we'll see much impact for them. So
yeah, Edith, oh, sorry. I was just going to confirm what you said in our conversations to date with Point 32, the new name for their entity. They've indicated that they don't anticipate any changes on the Tufts Direct kind of side of the house with respect to their participation in ConnectorCare and the like, and that it will really be Harvard Pilgrim and Tufts Premier kind of blending into one, more under the Harvard Pilgrim header. So I'm not sure either of those have implications from a budget perspective, but we're hearing that that's all in play for plan year 2023. So agreeing with Edith.
So if there are no further question, I'll end it back to Newport to discuss FY23 enrollment.
Edith. FY23 projected enrollment reflects a 9.1% increase relative to FY22, largely due to the assumption that the public health emergency will end on April 15th, and QHP eligible members currently with Mass Health will begin to enroll in Connector coverage. The projected increase is largely driven by the ConnectorCare population, which is projected to increase by about 66,000 members over the course of FY23. Are there any questions on this slide?
Newport, is that 9% a number that's correlated to the increase that we saw in Mass Health as a result of the emergency, that we think those people are going to roll back to us? So where's that number coming from?
Yes, thank you for your question. I'll defer to Edith on the
It's certainly strongly informed by that. You know, we've worked closely with Mass Health on the projections of underlying eligibilities. But Edith, do you want to respond more specifically?
No, I mean, that's what Louis said is right. So we have meetings with people from Mass Health where we're talking about their projections and also who is currently under the protection, COVID protected. And we made some assumption based on that. And there are a lot of people that are COVID protected at this point. So we are only assuming that it's a relatively small proportion of them actually that are coming to ConnectorCare. Some of them will be eligible for other QHP, but not necessarily ConnectorCare. And some will go back, I guess, to an employer.
Do we foresee any impact on our population based on changes that's going on in the economy right now with regard to the increase in inflation, which long-term may impact employers and folks who are currently employed?
Yeah, that's really hard to predict, Dimitri, but it's another really important area to think through the implications of. I'll be candid that we have not modeled inflationary economic impacts in our modeling of these projections. I think we would need some guidance in doing so. We've never kind of done inflation-based modeling of our population. We have factored in, as mentioned on earlier assumptions, the likely increase in the federal poverty level thresholds that bear on our subsidies. But in this chart, we do not reflect kind of economic inflationary impact modeling on the economy. We could look further into that to see if there are things that we really should be watching out for.
I am asking because other agencies seems to be factoring, private entities seems to be factoring that into a lot of their decision-making process for the next couple of years. And I'm just wondering whether or not that's something that we ought to be looking at as an agency. And I'm just throwing that out there.
I think it's a really good suggestion, and we will follow up on that. Thank you.
Thanks.
Key assumptions that are reflected in the FY23 budget, in addition to enrollment, are the completion of all CXP implementation activities, the depreciation of all capitalized implementation expenses as per GASB 51, and a requested 2.5 million increase to the CCTF request. Please note that significant uncertainties still remain, especially around the impact and duration of the COVID pandemic, as well as potential impacts of federal legislation such as the Build Back Better Act, if passed.
Nooper, there's one other uncertainty that I neglected to add to the list, and I only mention it for completeness sake. There is a scheduled renegotiation with Accenture regarding certain pricing elements later this spring. And I anticipate that it will end well, but until it's locked down tight, I just mentioned that as one area of uncertainty. But as I say, I mention it only for completeness.
Thank you, Louis.
And for clarification from my perspective, is one of the basic.
Hi, Dimitri, we just lost you. Hello, Dimitri, or is it me?
No, it's not there. He's frozen, but he just moved. So
I can hear you guys. Anyone can hear me?
You're back. Yep.
Okay. I was just thinking if one of the assumption on the positive or negative was to Build Back Better, because as it stands right now, it doesn't look like there is much traction with Build Back Better. So I hope that we're not making any decision that we're going to see any Build Back Better resources.
No, and in fact, that's a clear assumption that we're not making. We have no clear line of sight to completion of the Build Back Better legislation, so we have removed any assumption of continued federal subsidy, of the enriched federal subsidy.
Thank you.
Thank you, Dimitri. Are there any other questions?
I just want to, I think that's prudent, Louis. It's easier to come back and redo. I mean, it's not easy for the budget people, but better to, once we know, have certainty, right?
Yep.
Secretary. As indicated on the previous slide, the FY23 budget reflects a 2.5 million increase to the CCTF relative to FY22. We included this chart here to put that in context, as the 37.5 million request is still lower than the request from the previous 5 years if you exclude FY22. Are there any questions here?
No question, Nooper, but just for the benefit of the other members of the subcommittee, this is something I did question if it was appropriate to be increasing the draw at this time. However, Carrie and team have illustrated that the absolute amount of our reserve is still below the recommended 6 months of expenses that our auditors have advised us to consider. So in that light, it does not seem like it's an inappropriate ask, but if any members of the subcommittee have concerns, I think it's certainly appropriate to raise them.
I think the question from my perspective would be, what would the alternative be if we did not have access to that resource? And do we have any sorts of, do we have a mock-up budget that reflect where we would need to make adjustments if that resource was not available?
I think the direct effect, Dimitri, would be that we would draw down reserves as well as revisit budget items. But right now, this assumes that we maintain a reserve position that's relatively stable with a break-even budget. If we stayed at the 35, we would take a $2.5 million decrement to reserve position and or further trim budget items.
So it always comes, Dimitri, from my perspective, it always comes back to what's the appropriate level of reserve to hold, because we do have we do have the money in the bank, so to speak, to be able to tap into. But does that mean that it puts pressure in later years to rebuild it, or is that an appropriate level to stay at?
And I think from my perspective is if 6 months is the magic number that we're looking at, then we should try to adhere to that as much as possible. And I don't feel that we are necessarily there, or that we're striving to maintain that 6 month buffer.
For context, and then we can decide where to take it. You know, when I started 7 years ago, the reserve position was at about $24 million. As you saw in the earlier administrative budget, we've allowed it to grow to about 32. My understanding of the accountant recommendation, though, the accountant can correct me should they wish, the 6 months would amount to about mid-40s in terms of reserve level. And so we're still, you know, a distance from the recommended level, but we've been steadily growing over the years. So our general recommendation is to continue modest growth year over year, in hopes of reaching what might be recommended as a fully stabilized position.
Yeah.
Thank you, Louis.
I think that's right, Louis.
Thank you.
It's been a long journey in the 7 years to get to where we are. And a little historical perspective never hurts in these conversations.
Yeah.
Louis, I'm definitely impressed in terms of where we were and where we are today, because I do remember the first day that I joined this board where we were, and it was not very pretty.
No.
Yeah, no. So thank you for that.
Yeah. Okay.
So on slide 15, you'll see that FY23 reflects a balanced budget. A key driver of this is call center enrollment and premium processing. The 1 million variance you see on the exhibit relative to FY22 reflects the impact of enrollment and increased CIC ongoing costs, but these are offset by a favorable cost structure for contact center ongoing costs in year 2 under Accenture. The 1.4 million variance you see for navigators outreach and education reflects outreach for the end of the public health emergency, as well as the simple sign up or easy enrollment program. FY23 additionally reflects the sunsetting of various projects from FY22 that include HICS noticing and OE improvements, strategic plan investments, ARP implementation, and one-time non-HICS system upgrades. FY23 also reflects personnel costs that account for the annualized impact of FY22 hires and inflation, as well as the timing of the racial equity project under consulting. Are there any questions on this slide?
Break even. Monitor my ears.
Yeah. Okay.
I think Rena's chair for life.
Uh-oh. Uh-oh.
Sorry.
Thank you. If there are no further questions on 23, I will quickly wrap it up. As you know, our auditors from KPMG are here to answer any questions, I believe, as part of agenda item number 4. But we're pleased to report that we submitted our audit on time to the comptroller, and it was clean with no material weaknesses or significant deficiencies. So thank you to everyone for that, with the support of us.
Fantastic.
Great work.
Thank you all. Okay, I think we're ready for the third agenda item, Rena.
I agree.
Okay. The third agenda item, and here we'll be asking my management staff to drop, except for the minute taker, who's Aaron Ryan and Kathy Hogan for any future votes. But otherwise, I'm asking my management team to lead the session.
Thank you all. Thank you.
you.
Nice to see you all.
Yep. Thank you all.
Okay. The personnel review agenda item is brief. We are still in public session. We've had a tradition of making this, though, a more closed conversation between the director and the ANF subcommittee. It's brief in part. This agenda item fulfills requirements of the Commonwealth Connector Board bylaws and state finance laws by providing senior staff salaries and vacation and sick time payout policies to the ANF subcommittee of the board. And those materials should have arrived to board members this morning. I regret their late arrival. The staff salaries, senior staff salaries are adjusted, are as adjusted last January through the present. And the vacation and sick time payout policies are unchanged from 2021 recommended into 2022. This item, this agenda item has also served in recent years as a vehicle for management recommendation on staff cost of living adjustments, which in recent years have been set at the prior year's increase in cost of living as measured by the Consumer Price Index. However, last year saw a significant surge in inflation as measured by the CPI, 7%. And circumstances require more care this year in recommending a staff cost of living adjustment that is not out of line with norms and comparable entities, including with reference to executive department, non-union management staff. I'm working with Alda Rigo of the Executive Office of Human Services and her Human Resources Chief to work on a closer coordination with what those executive department adjustments might be. But we need some additional time to create a recommendation that would be suitable to submit to the secretary and the chair of the ANF subcommittee. And so as a result, I am requesting some additional time to formulate a management recommendation to submit to our board chair and chair of the ANF subcommittee. I should mention that the prior budget, because I always request that the budget reflect CPI level increase, it carries a 6.8% staff assumption on COLA. Every 1% is worth $92,000. So to the extent that we decrement that to a more reasonable level, and say it's 3.8 or 2.8, we can take that, 92,000 for every percentage point and take it right off the top of any CCTF requested draw. So at the time that we do submit a management recommendation, we'll make an appropriate adjustment to the balanced budget reserve request. Finally, in part 2 of the personnel review is a brief self-assessment marking the key leadership activities of 2021. I'm happy to address questions on either part, but otherwise I'll mark my own exit to allow the ANF subcommittee any time if needed to discuss.
So I think my own personal opinion, but certainly everyone should weigh in, is that we should take the time to understand what other agencies are doing. We certainly don't. We've always in the past wanted to make sure that the connector was in line with other agencies, and we certainly don't want to start deviating from that practice this year. The only other thing I would say, and it's terminology, but while 2% increases were what we've become accustomed to, that's not the world we're living in right now. And by no means, I do think a 6.8% increase is eye-dazzling relative to what has been just the norm for decades. But if that is what we have to do, then that is what we have to do, because we are competing for workforce and resources, just like the private sector is and everyone else. And we need to make sure that we're doing our job.
Thank you, Madam Chair. And what I plan to do in addition to the coordination with EHS administrative staff is to reach out to some of our carriers and just understand what some of their plans are for fiscal 20, for calendar 22 and 23, as if known.
I think we do need a little bit more time on this, and suggest that there are things that I wish there's not complete comparability of the public sector and even a quasi or an independent agency with some of the opportunities that exist in the private sector. So I think we, and as these are public dollars, I think we need to just be, as we always are, and as the staff, very prudent about this. So, but these are different employment times that we are certainly finding ourselves in. And I appreciate that comment, Nina, but I think I would agree. We probably need a little bit more time, and probably my staff, if we have not been as responsive as we need to. Lewis, sorry about that.
Not at all, and we have the support we're all looking for.
Okay, yeah, it's been a bit hectic the past few weeks, so
I'm never lost for the imagination as to why. Okay.
Perhaps we can defer this and or we can always schedule another meeting or something if we need to. But I yield to the chair.
Oh, I have to say,
Dimitri, go ahead.
I have to say I concur with both you and the secretary with regard to needing more time. And what I would ask for is a better understanding in terms of what some of the other agencies are doing, as well as what some of the quasis are doing, so that we can make sure that we do the necessary to support our folks. But given that we've been in line with what the state has been doing as a whole, we have to take that under consideration as well. Our folks are doing a great job, and we certainly want to make sure that we're compensating them in kind with regard to their performance, but we also have to appreciate the fact that this is a government agency and that there are some limitations that we're working with.
Agreed.
Okay. Unless there are other questions, I will take my exit to allow any further discussion if necessary.
Thank you, Lewis.
Okay, then thank you so much. And thank you. I want to thank the Administration and Finance Subcommittee and our whole board, but for my entire tenure here, the support of the board has been an essential ingredient to everywhere we go. So thank you so much.
Thank you, Lois.
Thank you.
Take care.
Thank you, Lois. We're not going anywhere.
Yeah, I know. All right. So do we stay live for the KPMG?
Yes.
Okay, got it. Thanks, Kathy. Brock, I'm handing it off to you.
Rena, a question for you.
Yes.
I know normally we go into executive sessions for this part of the meeting, and we're still in public. So is that what we want to do, or?
That's what I was asking Kathy. You phrased it much more eloquently.
So I got word back from our general counsel is that, yes, it is a public meeting and it is to remain public until the end.
Okay.
Okay.
So let me request this then. Brock, is there any chance you can do this in 5 minutes? Because I would love to have a 5-minute executive session if possible.
Yes, absolutely.
Thank you.
So Good morning, and that was going to be my first question. How much time do we have? So I think we will go a little bit off script. So joining me this morning is Karen Farrell, and you know, when we meet with committee members, we kind of do two things. One is we go through the prior year audit at a high level, make some required communications. And then the second part that we typically have is what you refer to as an executive session. So I can do the first part fairly quickly, and Karen, forgive me if I expedite what would have been a longer discussion. So I think the highlights for us of the financial statements that we issued back in October, and again, it's, you know, we're 3 months past that delivery date. I think the critical items for the committee is the audit opinion itself is unmodified, clean opinion, something that I think you should expect from us.
Share my screen, if I could.
Perfect.
Yeah, Karen, I think we can take down the presentation. I'm going to just do this verbally.
I'm sorry.
And do it.
I was trying to, because I know that the committee doesn't have it, so I was trying to make it a little bit easier to follow. But
yeah, no,
okay.
If there's questions, we can kind of circle back. I think the other thing that's important is, you know, we're doing our audit in accordance with government auditing standards. And Carrie, or maybe it was Lewis, mentioned that a byproduct of the audit is a report on internal controls over financial statements. And that report didn't identify any material weaknesses, nor did it identify any significant deficiencies in internal controls. In terms of just the conduct of the audit, I think the critical item for us this year was the assessment of an impairment charge as you were kind of changing vendors on your back office operations. So we work collaboratively with management, and ultimately there was a $6.4 million impairment charge to your existing capital assets as a result of really switching from one vendor to another and having to abandon the fixed costs from the previous vendor, if you will. So, you know, I think, you know, normally we kind of walk through some of the significant audit areas, but you can imagine, you know, we follow the money. We didn't have anything that was unique or difficult that we would share with the committee, so we'll dispense with that. And I think I'll close the formal remarks on the financial statement presentation by just saying we got great cooperation from management. We always do. They're very welcoming to us, forthcoming, transparent, and always collaborative in suggestions that we might make. So, Karen, I did all of that fairly quickly, but I do want to invite you in for a minute just to see if there's some item that maybe I glossed over too quickly or maybe missed in terms of, you know, what we might want to share with the committee.
Yeah, I don't think so. I believe that the committee is going to get the presentation sent by Carrie after this. So on there, you'll see like kind of our extensive list of the required communications that, you know, we need to report to those charged with governance. But since they're documented, we don't need to go through, you know, each one with you. But like Brock said, there isn't anything in particular to mention, you know, of concern. And, you know, from management to staff, we got full cooperation throughout the audit. And it went, you know, fairly smoothly, as you can see, with no audit differences identified.
Fantastic.
And thank you, Karen, for rescuing me. I should have mentioned the required communications. That is important. And the fact that we'll have it on file is good for the committee.
Perfect. And anything as you're looking towards 2022 that is on your radar or that should be on our radar to be paying attention to?
You know, there's a new leasing standard that's causing some angst with a lot of organizations. I don't think the connector has near the amount of volume or complexity of leases, so that should be a relatively tame standard to implement. You know, I think we've talked in the past with management, and I think there is an agreement that there should be some independent assessment of the third-party service organizations that you use to process your back office operations. So we refer to it as a SOC report, and you know, We have kind of talked about that for years. I believe it's in your contract and you're working currently with your vendor to get that SOC report, but I think that's an important element of your internal controls, and we would encourage that,
Yep.
Document to be available, when it's ready.
Okay.
I'm good.
Okay. Anyone else? You guys okay? All right. Wonderful. Thank you.
Thank you.
Apologize for rushing you.
Oh, no problem. Thank you very much.
All right. So Kathy, I think we need a vote to adjourn the public portion of the meeting, and then we'd like just a brief executive session.
So moved.
I believe, sorry, yes.
I second if you need a second.
Thank you.
Okay, Secretary Sutters.
I move to adjourn. I approve to adjourn. Sorry. Clearly I need my lunch.
Rena,
Yes.
Hey,
Dimitri,
Yes.
Cassandra,
Yes.
Ruth.
Yes.
Fantastic. Thank you. So,
do we need a second before it closes out?
oh yeah.
How will we know?